Hi, Senator Mark Warner here. Wanted to bring you up on the latest steps of what's been taking place here in Washington on dealing with the coronavirus. I'm going to talk about the legislation that by the time you see this hopefully will become law that I've been working on. I literally have been closeted with the Secretary of the Treasury for hours on end over the last number of days and other Senate colleagues as we tried to make sure that this relief package, which will go down as the largest relief package ever in American history, was done right, was done smart, was done with the appropriate oversight that I think all Americans deserve. I will tell you that negotiating with the Secretary, I think he has been straightforward and a fair negotiator, and I hope as this bill is rolled out, and more importantly, the programs are rolled out, that we can get this assistance as quickly as possible to Americans in need. Let me go through some of the key provisions. First, there will be direct payments of $1,200 to every American adult up to a certain income threshold, along with close to $500 to $600 per child. So most average families would see an influx of around $3,000. We want to make sure that capital gets out there quick and in an efficient manner. Second, there'll be a major program to assist small businesses. Think here about your local restaurant, barber shop, local retail store. We will provide one of the most generous packages ever to make sure that at least for the next 4 to 6 weeks, these small businesses can keep their employees on payroll and make sure they don't have to simply close down their businesses. Because with no revenue, we've got to keep these small businesses alive, or even when we do reopen for business, many of them will not come back at all. Third, we've greatly expanded for those workers who are laid off, unemployment insurance. Finally, to cover the whole segment of the workforce, gig workers, independent contractors, freelancers, who in previous unemployment programs didn't receive any coverage. I think that's an important step. I've also been working on a program to make sure that businesses larger than small businesses, for example, over 500 employees, have access to credit as well. An awful lot of Virginians, an awful lot of Americans work at that firm with 800, 1,000, 1,200 folks. I wanted to make sure there was low interest loans for these businesses, but I also wanted to make sure that these funds were not used for stock buybacks, dividends, or excessive executive compensation. And all of these lending programs, I wanted to ensure as well that there was appropriate transparency so they wouldn't see some of the abuse that took place after the financial crisis in 2008 and 2009. And finally, in a major way, there's over $100 billion, what we're calling in a sense a Marshall Plan for hospitals and healthcare across the country. These are folks who are helping keep us safe. They need to get the resources, whether they're in nursing homes, whether they're at their doctor's office or in the hospitals, to make sure they, EMTs, first responders, both have the equipment they need, but also the support they need. We've asked hospitals, for example, to not perform elective surgery. That's where hospitals generally make their money. Having somebody in that's quarantined with the needs for respirators, that is not a money-making item for hospitals, so we need to provide the financial support there. There are a series of other components of this bill. I'd be happy to visit my website and we'll lay out that in more detail. My sense, though, is we took an important step forward on the economic front to make sure that we can stabilize our economy, and on the healthcare front to make sure that our healthcare first responders have the resources they need to do the extraordinary job they're doing.